Hi, everybody. Welcome to our podcast. My name is Natsai. I've got Howa with me today. I'm really excited because we're talking about one of the most important things that nobody talks about, oral health and oral care for our children that have got autism. For those that don't know me, my name is Natsai and I'm a naturopathic nutritionist and I specialize in looking after children that have got complex autism. Oral health is also something that we need to pay attention to because, like everything else, if you don't look after your child's oral health, then it's going to cascade and develop, and they're going to end up developing other issues that we will not be able to deal with in the future or that will cause unnecessary complication. So I brought the expert in the house and she is going to support us, answer those questions that we may be having and help us navigate this oral health, oral care for our children. Howard, darling, you're welcome.
Thank you. Thank you, Sai. My name is Howa. I'm a dental hygienist and a dental therapist. So, what is that? As a dental hygienist, we focus on prevention, so prevention of disease, mainly gum disease as a hygienist in both adults and children. So, we want to try and make sure that children are not suffering from gum disease or inflammation of the gums or just inflammation in the mouth overall. And then I'm also a dental therapist. So we deal with two different types of diseases, which is tooth decay and also gum disease. And tooth decay is something that affects both adults and children. And as a therapist, what we do is we prevent that, but we also treat it as well. We treat it in children, whether it's extraction of teeth or filling of teeth. And ideally, what we try to do is also prevent it by giving you advice. So I think it's very key, especially in children with autism, because their diet can sometimes be quite restricted and there's so many different factors that can affect them. So we're going to go through a few of them today. So the main aims, the main things I would like you to focus on is I would like you to focus on as I'm speaking, I would like you to take away from today what is tooth decay and what is gum disease, what causes it, and how can we prevent it in our children. And then also, I want you to take away how you'll be able to communicate this to your dentist or to your dental hygienist. So, how you'll be able to explain what you're doing and why you are doing it. Sorry if my lighting is changing. I'm dependent on natural light at the moment. So yeah, I think it'll be important for you to know how to explain yourself to a dental professional, why you're doing what you're doing for your child, and what oral hygiene regime you're following. And then thirdly, just pick one thing as I'm speaking that you would like to implement or change, because trying to change too much for a child with autism can be overwhelming. So we want to focus on just one thing, just change, and it can be overwhelming for you as well. And you may fall into despair, and we don't want that. So just pick one thing that you can change, and then follow through with that. So I'm going to start with sharing my screen. So we're going to be focusing on oral care for children with autism. So we'll start off with a definition of autism. So autism is a spectrum disorder. It's a neurological disorder that affects normal brain development. Something you might notice, like a word you might notice we use when you see the dentist, they may use the word neurodivergent. It's because they want you to know that your child can be educated, and it's important that we do take time in the appointment to speak to you and also your child. And this basically means that they're having the way their brain works is slightly different to a neurotypical person. So the way they learn and the way they interact will be different. So we will interact with them in a different way, in the way that suits them best, in the way that they learn. So we'll start off understanding what tooth decay is and gum disease and how this can affect your child. So tooth decay is something that is caused by bacteria. It's caused by plaque. So when you look at the second picture here, you can see that bacteria is involved, sugar in diet is involved, and it requires time in order for decay to happen. So everybody has a microbiome, oral flora. We all have bacteria in the mouth. It's always there, even after you finish brushing. But the purpose of why we brush is to reduce its accumulation, to stop it from materializing and causing problems like this. So if you have bacteria on your teeth, and a buildup of plaque, and you have sugar to eat, the bacteria feeds on the sugar and produces acid. Now, the mouth is very, very sensitive to change in pH. So once it's more acidic in the mouth, it then gives the environment for the bacteria to demineralize the enamel. So it starts to soften the enamel and create holes in the teeth. Once it does that, bacteria continue to infiltrate and they just make it their home. And that is how decay happens. It happens over time slowly. So while it's happening over that time, we have many opportunities to prevent it from getting worse into a full-blown hole in the tooth. So as you can see from the tooth decay progression photo, you can see that first tooth looks absolutely fine. It looks like there's no hole in it at all. But actually, decay has started in the tooth because of that bacterial and sugar diet. The demineralization process has already started to happen. And as you can see, as time goes on, sometimes years, sometimes months, depending on how much sugar you're having and how bad the cleaning is, the hole gets bigger and bigger and bigger. So what you would find the dentist would do in the situation is in the early stages, if you were to see a dentist, they would monitor it. They may also advise you to use certain things like fluoride toothpaste, which we'll talk about later on. And they will try to do a lot of preventative things to stop the holes from getting bigger. That's ideally the plan. Once the hole's already there, they have to close it. So what they'll do is they'll remove the decay and they will put a filling in place. Now, it's important that you make the right choices for filling material that you would like to be put in your child's tooth if you are in this situation. You would try to avoid metal fillings. Now, here in the UK on the NHS, usually a metal filling would be straight away what they would do without question. So if you would prefer a different type of material filling, it's very important that you let the dentist know that you would like a different material. Reason why we don't want metal or amalgam filling, mercury filling in children with autism is because we're trying to reduce that whole metal forgot what the word is. You don't want them to have all these different type of metals in the body because the mercury also it releases over time, especially if they need to change the filling and things like that. So it's better to go for other options like composite material, which mimics the tooth and it actually binds directly to the tooth. Materials that will not leach out minerals, if that makes sense, or metals will be better overall for the health of and progression of your child with autism. So to prevent decay, we want to get rid of this thing here, the bacteria, but we also want to get rid of the sugar and we also want to reduce the time. If any one of these things is eliminated, either the bacteria or the sugar, then decay will not happen. So if let's say you have eliminated sugar from your diet, but you have lots of plaque on the teeth, decay will not happen because there's no sugar in the mouth or in your diet for the bacteria to feed on. This is very crucial because I know parents tend to get worried when they can't get a toothbrush in their child's mouth or because it's very difficult to clean their teeth. The other way you can fight this is making sure the diet is without sugar. Make sure it is a very clean diet. If you're struggling to brush your child's teeth, at least if you've eliminated the sugar, decay will not happen. And let's say you are brushing the kid's teeth really well, still in a child with autism, you do not want sugar to be high because it causes a lot of different inflammatory issues overall for the body. So the safe side is better to eliminate sugar where you can. So cause of gum disease. So we're moving on from tooth decay to gum disease. You can see this picture here. The gums look very inflamed. They're very red. And you can see almost like a film over the teeth. It doesn't look smooth and shiny. That film that you're seeing, that's the plaque that has built up. So plaque starts off with a very thin layer as soon as you finish brushing, and it builds up throughout the day. What makes it build up more? Sugar. The more sugar you eat, the more plaque attracts to the teeth, and the more this will build up. But if you're eating healthy food, let's say you're eating cucumbers, natural fruit foods, it actually cleans the teeth as you eat. So you will not get this buildup of plaque as you're seeing here, and there's nothing for the bacteria to feed on. So this plaque builds up, and then what it does is it sends a message to the body saying, we are being invaded. And so this inflammation you're seeing is the body's response to all this plaque that's on the teeth. So when you see bleeding gums in your child's teeth, it's not healthy. Healthy gums do not bleed. It's a bit like if you were to rub your skin and it started bleeding, you would think, what's going on? You need to see a doctor. Similar with your gums, they should not bleed. If they're bleeding, the body is telling you something is wrong here. There's plaque here that is disrupting the environment, and you need to change that. And the teeth are unique. They are outside the body, but they're also inside the body. So the body cannot do all the work. It needs our help to mechanically remove this plaque. Once we remove this plaque, we will notice a lot of bleeding as you're brushing. A lot of bleeding because this plaque has been here for a long time and the inflammation has been there for a while. And in children with autism, we want to reduce inflammation everywhere we possibly can, especially in the mouth, because in these teeth and in the mouth, there are also blood vessels which connect with the whole body. So it's very important. If there's inflammation in the mouth, chances are there's inflammation elsewhere in the body. So you want to really try and get this nice and clean and make sure that the bleeding stops. When you're brushing, you'll see the bleeding, but eventually, as you're consistent with the brushing and the cleaning, the bleeding will stop. And you'll have no more bleeding. The gums, the body will do its work itself. It will heal up, the gums will be firm, and this strong red color will disappear and it will become more of a pale pink, firm gum rather than a loose, shiny, and glossy, like you can see there. So how can we remove it? We remove it with effective plaque removal. So electric toothbrush is the best. This is not a biased opinion. This is based on evidence. Those who use an electric toothbrush are less likely to get tooth decay, less likely to get gum disease. There's lots of research everywhere. You don't have to be a scholar to find it. You can just use PubMed if you want to. The toothbrush I recommend for children is this one here, which is the Oral-B toothbrush with a round head. It's a princess one there, but you can definitely get Spider-Man or whatever type of themed character that you want. You can actually get it, and they can decorate it with stickers. You can make it fun. So when you get the toothbrush, introduce it to them, show them, let them hold it, let them play with it, let them switch it on, let them put stickers on it, let them run around with it if they want to. Just let them familiarize themselves with it. Because when you just pull out a new toothbrush and you say you're going to brush your teeth, a child with autism is going to panic. Like, what is this thing and why are you putting it in my mouth? Also, with electric toothbrushes, something to be aware of is the sensory issue. So this brush spins and it also vibrates and it's also very noisy. So that can be a lot of hindrances for a child with autism. So I have a nephew, he is now 7, and he's also on the spectrum. And initially, he did not like using an electric toothbrush. He would not even let us put it in his mouth. And it was very difficult for his mom initially. She was very worried, how he can get his teeth clean. And he has a brother who is about a year or 2 years older than him. He's not on the spectrum. And when he was about 4 years old, this is when everything was a big panic of trying to use the electric toothbrush. We realized that his teeth were much cleaner than his brother's. And it will make you think, how is his teeth cleaner than his brother's when his brother brushes with an electric toothbrush? And it's easy for us to get in there and brush his teeth. The difference was their diet and something Noah was doing. So my nephew's name is Noah. Something he was doing was he was chewing on a lot of things. And when he chews on his sensory toys and all these different things, they were actually cleaning his teeth. So when you see sometimes children eating on a piece of cucumber, something hard but still a bit soft, it's actually cleaning their teeth. So because he did that quite often, there was little to no plaque on his teeth in comparison to his brother, whose diet would have very different things in it. So that was very interesting to see. So do not despair if your child is not using the electric toothbrush or doesn't like it after you spent all this money. Persevere. Now Noah is about 7 and he uses an electric toothbrush because we kept bringing it back to reintroduce it. And one day, and it's important as well, when you're introducing it, let them have a go. Don't be the one to do all the brushing. Maybe you could do a little bit and show them and kind of demonstrate it, but then pass the brush to them and let them have a go. So when Noah started to do it, he would just bite on the toothbrush while it's still buzzing because he liked the sensory feeling all of a sudden. And he liked to kind of feel it on his back teeth. But you just kind of encourage him and move the brush around. And eventually he gets used to the sensation of the electric toothbrush. So persevere with it, but do not panic if they're not using it. On the side here, I've put sensory brushing tools. You can use this instead in the meantime. Let them use sensory toys. Obviously, try and make sure that they're BPA free, plastic free. Try and get them some sensory toys like this. It's got a handle and they can just chew on it and clean their teeth with it. Another thing you can do is use vegetables as well, hard vegetables, which they can just chew on. That's natural. You don't have to worry about the plastic in that. They can just chew on that. It also will help them with their diet as well, to getting used to other textures and flavors too. So that's very important with the brushing. So the main takeaway from brushing is if they can't use an electric, use a sensory brushing tool. And even if they don't like the sensory brushing tool you've got them, still get them other sensory toys. They'll find something that they like to put in their mouth. And that thing will actually be preventing tooth decay. Okay. So now we're going to go on to toothpaste, the moment probably most of you are waiting for. To use fluoride or not to use fluoride. So when you go to most dentists, they will tell you to use fluoride toothpaste. And they may recommend one like you can see here on the side, the Aqua Fresh or Colgate, children toothpaste. And it usually will have fluoride levels of about 1,000 ppm. So that's parts per million. Now, the pros of using a fluoride toothpaste is the evidence shows it prevents tooth decay. It's been doing that for years. It remineralizes enamel and it also reduces the progression of existing early decay. So remember the tooth that we saw in that progression at the early stage, what they'll do is they'll get you to use a fluoride toothpaste. They'll probably add some fluoride to the teeth, and this will remineralize the area where the decay has started, and it will neutralize the acids. And that's what helps to prevent the decay. However, there are cons to fluoride, especially for children with autism. So I'm going to explain. So studies on animals and humans concerning fluoride intake shows neurotoxic and nephrotoxic and other adverse effects in small doses. So that's even in small doses, and we're talking like even like 1 part per million. But in the toothpaste, there's 1,000 parts per million. Now, the reason why this is key for autism children, apart from even children in general, neurotypical, they will eat the toothpaste. They will not spit it out. In fact, spitting out mechanisms do not start for a child till 6 years old, which is why we do not give mouthwash to children until they can spit out. But when they reach that 6 years old, that's when they can spit out. But sometimes with children with autism, they spit out when they want to, not when you tell them. So it's a little bit different. They're definitely going to eat the toothpaste. So it's very important that what they're ingesting is not going to be toxic, especially to their brain, because their brain is very, very important in the whole process of managing their autism and for them to be able to live lives that are much more simpler for them. So it's very important for an autistic child not to use fluoride at this stage anyway. And so what can they use instead? What they can use is something called Gotology. So this is actually quite a new toothpaste, but something that's pretty amazing about Gotology is that they're using something which is called a biomimetic hydroxyapatite. So with the teeth, our teeth have something on it called enamel. Enamel is the hardest thing in the body. That's that layer of the teeth where you see that makes it look white. The second layer is what we call dentine. Now, this enamel is made up naturally of hydroxyapatite. That is a thing that makes it strong. That is a thing that is naturally occurring in it. So what they're using here is the closest thing that is naturally occurring, which is hydroxyapatite inside the tooth. And they put that inside the toothpaste. The difference between this and a nano is the nano hydroxyapatite is artificial. It's not natural. So you want to be looking for something that says biomimetic hydroxyapatite. This basically mimics the same way hydroxyapatite works. It covers the area of the remineralized where remineralization needs to happen. So where it's demineralized, it will help to remineralize and replace where minerals have been lost, similar to how fluoride works. So the way fluoride works is when the tooth has been demineralized, it's usually hydroxyapatite that's been demineralized, and then the fluoride replaces the minerals to make it stronger. And similarly here, you're doing the same thing, just instead of fluoride, you're using the same natural material that is in the tooth. It is fluoride free, and it's also helpful for your gut. Now, this is very important for children. There's been a lot of research in regards to the gut and brain relationship. And they describe this relationship as being bidirectional. Bidirectional basically means that it works both ways. So just if the gut is not in a good condition, it will affect the brain. If the brain is not in a good condition, it will affect the gut. So they have a communication. So it's important if your child is ingesting some of this toothpaste that it's going to be helpful to the gut or at least not disrupt it. So they've made sure with this toothpaste that it doesn't do that, and it's very supportive to the microbiome in the mouth and also in the gut. So this is what I would recommend for children with autism. And also the next thing that is very important as well is diets. Diet is very important. If your child must chew on something and they have autism, it's better for them to chew something like a cucumber, and you can give to them the cauliflower raw as well, or give them the chicken bone as it is. You can use natural things. You can use apples. I would try to say go for organic apples, ones that are not too sweet, because once a child with autism gets used to sweet things, it can cause more of an issue with their diet. So try to go for the vegetables or the fruits that have a neutral taste or that are low in sugar. Um, Mind you, even though they're eating the fruit or vegetable, because they're eating it in its most natural form, the sugar actually does not harm the teeth. The type of sugar that harms the teeth is when you blend the apple or the blueberries or the fruit, when you blend it into a smoothie, all the sugars are released, and that's when it can affect the teeth. So as much as you can have it in the natural form for your child, try to do that. Try to have a diet that does not have any sugar in it. It's important that there's no sugar. If there is sugar in the diet, for your teeth, it's important to limit it to 3 to 5 times a day. What does that mean? So let's say they've had oats, for example, and you've put a blueberry puree or strawberry puree on there, which has sugar in it. That will count as a sugar attack. Though it's healthy, it changes the environment in the mouth and makes it more acidic. So if you're counting this throughout the day, you cannot have more than 3 to 4 of them. If you do, you're creating the perfect environment for the bacteria to create holes in the teeth. And you're also not giving the saliva enough time to neutralize the acids. So your saliva plays a key part in this. So when you see your child has lots of saliva, this is a wonderful thing. This is a great thing for their teeth. It has antimicrobial effects, it has antibacterial, and it also has minerals in it which remineralize the teeth and keep them stable. So you want foods that promote that, and you want to give it time, the saliva time to neutralize any acids in the mouth after an acidic meal. You want to avoid sugary drinks. I really feel for children in general, no sugary drinks. They don't need it. It's usually us implementing what we feel is nice or what we feel is good, but that is not what they need. And who said it's nice? Who said it's necessarily good? We do that because we have this addiction to sugar because it's sweet and it makes us feel a certain type of way. We think, okay, if I give this to my child, this will make them happy as well. But you do not want to do that, especially with children with autism, because they will be addicted to the sweet taste. Stick to water. Water is key. Once you're having water, that is the most important thing. You don't need anything else. That's what your body needs. Let them drink water. If you must give them a juice, let it be freshly made and dilute it. Try your best to dilute it. Because the sugary drinks are the main culprit for tooth decay, because people can be sipping on it all day long. They drink a little bit of the fruit shoot, put it in their pockets, drink it again. Before you know it, they've had 7 sugar attacks. The saliva hasn't had a chance to neutralize acids, or they give them a bottle to go to bed with a sugary drink or sugary milky drink, and they have 10 sugar attacks, poor baby, and now they've got tooth decay. And the only way we can take it out is to put them under general anesthesia because they're non-cooperative. We can prevent all of that. We can prevent doing all of that just by not giving it to them. So if you have it at the back of your head, by me giving you water, we're avoiding general anesthetic, we're avoiding you being knocked out just to have teeth taken out, we're avoiding you being bullied for having teeth taken out early and waiting on adult teeth for years, because your adult teeth do not come to 6 years old. So they have to maintain those baby teeth from 6 months. all the way to 6 years old before their adult teeth start to come through. So we do not want them to be removed early at all. It will also affect their speech, which is something already a child with autism is struggling with. We don't want them to lose their teeth early, which will affect their speech again. So we want to keep everything in place. So just remind yourself of these different tips. This is why I'm doing it. This is why I'm doing it. So that you don't feel like they're missing out, because water is good. And depending on how you are responding to the water, they can be excited as well. Um, and then we have foods in its natural form. We spoke about that, and low oxalate. So I said cucumbers and pears. Pears, I would say try to go for the ones that are like hard already, not soft or ripened. Because they once they ripen, they have a lot more sugar in them, and also they don't really do the work of cleaning the teeth. So I have offloaded a lot for you guys. So feel free to have any, if you have any questions, or anything in particular to your child that you would like me to answer. I do also have social, so feel free to message through social media as well. But I think it's very important that when you do visit the dentist, you know, this is how tooth decay happens, and this is how I'm preventing the tooth decay from happening. So I'm trying to introduce my child to an electric toothbrush, but in the meantime, we're using these sensory things to make sure we're having adequate plaque removal. And then in the diet, we have no sugar. So this is how we're preventing the decay. So we are not going to use fluoride right now, because this is how fluoride affects my child. It affects my child because it affects the brain and it affects their gut. And for my child, it's very important that their gut is really good. And also because their autism is triggered by neuro disorders and neuro issues, problems with the brain, I need to make sure that this is nice and healthy for them. So therefore, this is the toothpaste that I'm using for my child. And I'm aware of all the risks. And I've mitigated those risks by doing low sugar diet, by making sure that we're doing adequate plaque removal. So now what I would like you to do is to check, how are we doing with our plaque removal? That's all you want the dentist to do. How are we doing with our plaque removal? Do we have any decay or teeth that we should be focusing on more? Do you have any tips of how I can focus on these areas more with my child? Because depending on how your child's teeth are, because some children, they suck on their thumb, the positioning might be different. And so the hygienist or the dentist can spend some time showing you how to get around each tooth. I would always advise, when you're brushing your child's teeth, you should be higher than them. So either they're sitting down, or if you're taller than them, they're by the sink, because that will help you to be able to see exactly where you need to go and what you need to do. But involve your child, make it fun. You could do a reward system with them. You've brushed for 2 minutes. We played a song, if you can get 2 minutes out of them. By the way, if you don't get 2 minutes out of them, it's absolutely fine. It's absolutely fine if you can't get 2 minutes out of them. If you get 40 seconds, it's great. I will cheer you on. That is absolutely great. Just kind of work with them, keep persevering. As you're following the size program as well, you will notice your child is developing and things are changing. What they used to not like or what they used to find difficult now has changed. So now they can use an electric toothbrush. Now they understand this toothbrush is not going to harm me or it's going to cause these issues. Rather, I can use it for this. So keep educating them. Keep telling them open wide, that you want to look inside and see their teeth. Even in random moments, just say to them, open wide, let me see your teeth. Let's count your teeth together. Just so they get used to that idea of someone looking at their teeth. So when they come to the dentist, they kind of know what to expect when the dentist says, open wide, let's have a look, let's count the teeth, and things like that. So those are just a few things to expect. I could go on for ages. There's loads more we can do to help your child, but ideally it would be something that is tailored for them. So I hope that you'll be able to find a dentist and hygienist who is loving and patient, to help you through that. And I would recommend, if you do find someone, stick to them, because children with autism do not like change. So don't change the dentist every time they come in. It will not work. Stick to the same person. Once they found someone that they like and they respond to a little, stick to that person, because there's something about that person, maybe the way they talk or their level of their voice or how they deal with them, they like them. So stick to that clinician when you find them, but don't give up, because there will be some clinicians who do not know what to do at all, or who would tell you that you're crazy for not using fluoride. Just remember, you have a plan and you know what you're doing for your overall child's health. So as long as you remember that, you don't need to despair. You can confidently say, this is what I'm doing, and this is the backed up research for why I'm doing what I'm doing. So I will send this PowerPoint to Nasai as well. I have linked some of the evidence and link for the toothpaste as well. So if you want that, you can request it from her. This is me on YouTube. It's Clean Teeth Chronicles. And on Instagram, it's your favorite hygienist. Mainly because I couldn't get Clean Teeth Chronicles on Instagram. But yes, so there's going to be some new content definitely coming up this year. So before the end of the year, look forward to some new content. Just there's lots of information and lots of things to share. And even though a lot of the information might just be broad, you will find information for your child on there and for yourself. Because if we are creating those habits ourselves, our children will follow suit. So there's a lot to learn, but if you start with the mouth, it really makes a whole difference to the whole body, especially in reduction of inflammation, what you're ingesting, what you're eating. It all starts with the mouth, and the mouth talks to us. It tells us what's actually happening in the body. So we just have to listen. So if you see inflammation, you see bleeding, something's not right. Let's bring down that bacteria. Let's start up the healing. And if you notice the gums are healing quickly, that means, okay, the body's doing its work. It's actually healing well. So let's give it the things it needs to promote this healing process. So yeah, there'll be lots more stuff to see. So thank you for enduring my long talk. It's much appreciated.
I'll tell you what, I actually enjoyed that. And I think we can actually go into a little bit of a conversation now, just to recap
Mhm.
some beautiful things that you've actually said. I promise you, I was just like smiling away and thinking, oh my God, I thank God she's saying that. Thank God she's saying that. Thank God.
Oh,
Because practically you're validating all the things that I talk about. For those that are in the deep dive program, you're kind of like, "Whew, we are all good," because in terms of the diet, we go to town about the importance of no sugar, no
mhm.
sugar, no sugar. And also for those that have not yet seen All Things All Sugar in ebook, just comment below and just say ebook, no sugar, and I'll be happy to send you that ebook that actually shows us where sugar is, because I promise you there is sugar everywhere. And because how are you've really grilled in the subject of sugar. I just want to say this to most people. And I have clients coming all the time and they say, Nata, I've got no sugar. There is no sugar in my diet. There is no sugar in my diet. And by the time we go through their therapy tracker, I promise you, sometimes we literally go to 40 teaspoons of sugar a day. Really, Natsa? You may be asking, is that possible for somebody to eat so much sugar? Yes, that is so easy. So easy. So I want to give you a little bit of a tip to think of that you can, start using. So every time you're looking at your ingredients, always remember when you see where it says grams, okay, that's what you're looking for, grams of sugar. You're going to remember 4 grams of sugar is 1 teaspoon of sugar. That's simple. 4 grams of sugar is 1 teaspoon of sugar. So, for example, if your child's cereals, cornflakes, say 16 grams, all you have to do now, it's more than that, believe you me. I saw your face. That's a lot of sugar. All you have to remember now, you're just going to say 16 divided by 4. So automatically, if your child had 16 grams of sugar in the cornflakes, it actually means that your baby has just had 4 teaspoons of sugar. Okay. And if you calculate all that during the day, you'll actually realize that your child is possibly having a lot of sugar. And that's going to drive, the tooth decay that we are talking about here. And if you want to think about it, like I love what you just said, if there is bacteria, but there is no sugar, there's not going to be any tooth decay. I thought that's quite a big relief for most of us, especially those that have children that have got sensory issues. So our task, our first step, am I right? Am I right? Did I
Mhm.
just say it right? Am I right? Our first step is let's remove the sugar. Let's remove the thing that feeds into this decay, which is the sugar. So take away 4 grams of sugar, 1 teaspoon of sugar. For those that are in the deep dive program, week 2 is going to be very important. So focus on doing that right. And the other thing that I really loved that you say, guys, I'm just recapping this for mummies like me who probably have got their head like, oh my goodness. One thing that I loved what she said was how you said it so beautifully. The truth is both outside and inside. And I've never like really thought of it that way to say part of the truth is actually inside and outside. I've always thought of, by default, the truth is outside, right? But the truth of the fact is the truth have some part of the truth is inside. So if you have tooth decay, if you have inflammation, that's a direct pathway to the blood system,
Mhm.
right? That so we need to pay attention to that. We need to take that seriously, I guess, because we are trying to protect our babies, you know, health, and we're trying to reduce inflammation. We're trying to reduce neuroinflammation. So if we look after our baby's teeth, it's very likely that they're going to have healthy mouth. The mouth is going to be healthy, and we're not going to have inflammation, cascading into any part of their body simply because it's inside the body. I thought that was profound. Um, and then the other subject of the toothpaste. We will talk about the toothbrush. Last week I was with Lisa. We talked about myofunction, and we were talking about desensitizing our children's mouth, those that have got that are picky eaters and those that have got that are not speaking yet. Okay, we always say yet because we believe all our children have the capacity to talk. And I loved it when you talked about the toothbrush, and I was like, yes, that is someone else saying that's the way to go. Electrical toothbrush. It does more than cleaning the teeth, I promise you. It also supports desensitization of that oral sensory, you know. And so just get an electric toothbrush. Get them. I mean, I'm not going to go to town about that because you've done such a beautiful job in explaining how to do that. But invest in one that is good. I liked that other one and those little tools that you talked about. We will pin all those things for you guys, and of course I'm going to pin our information, and you guys can follow her. But I thought this is something that I need to emphasize because if your child is not speaking yet, right, the oral muscles, like what we spoke about with Lisa, we're connecting them to this whole subject of oral care. So get your electric toothbrush. I think that was profound. So desensitization. And then the other thing that you said that was really beautiful was the subject of using vegetables, really using vegetables. If your child is still stressed out, and I see this all the time with most of my babies, we don't have teeth issues. We have tooth issues for those that come to see me late because they've been having a lot of sugar issues. And I always say to mom, let's look at what is going on in the mouth. Take a picture. I want to see the teeth, etc. And this is where you're coming in. And yeah, it's pretty scary. But for some children that have been working with us for a long time, their teeth are really beautiful because of that element of bringing in vegetables. So if your child is struggling, especially our babies that have got pick at the babies that want to put everything in their mouth. The carrots, the cucumbers, like what you said, the hard pear is beautiful. So if you go to Sainsbury's or Tesco's, you actually they are very different. Actually, they are a little bit hard. The ones that are crunchy. You can get your child to be on those. For children that don't have issues with oxalates, you can enjoy the apples, right? You can enjoy the apples. However, just a side note, and tin, 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 right? Too much of all fruits can also drive tooth decay because there's sugar in fruits. So bear in mind, like what Howard said, especially the ones that have already, that are overripe, you want to kind of shy away from that. What else did I miss, darling? That you said? I think
I feel like you did really well. Yeah.
no, I was listening. I told you I was going to write notes.
It's really good. You got lots of points.
I told you I was going to write notes. And then, of course, you talked about the avoiding fluoride. That's a big subject on my part. You guys, you hear me talk about the endocrine system. For me, fluoride will affect our children's endocrine system. So that's why we talk about protecting the thyroid. And unfortunately, fluoride is one of the things that will drive those issues. So yeah, we don't do fluoride. So if you're in the deep dive program, we are going to eat this toothpaste that you beautifully, introduced us to. I'll add it onto our downloadable in the deep dive so you can easily get it, because that's really beautiful to have another edition where you can go to. I love the fact that it's strawberry as well, which means that it smells nice and it tastes nice as well. And I think I love the fact that it feeds the good bacteria. I mean, what more can you ask for? What more can you ask for? So I will add that in, but definitely a million times it's a big no to fluoride, and big no to fluoride, and mainly in with where I said, because I see a lot of children that are complex. The thyroid is very vulnerable for a number of reasons, and fluoride is an endocrine disruptor, and we do not want to use that. And of course, it drives some of the, the things that you beautifully put out there, like drive neurotoxicity. We do not want that. So if you have any questions, beautiful souls, just comment, let us know. That this podcast is probably going to be sitting beautifully as part of our deep dive program, and it's going to be on YouTube. I am going to tag Howard to everything. And if you have many questions, I promise you I'll drag her back, because I promise you I have no answers to some of the questions, because I'm not a specialist in this area. But equally, honey, I really thank you for coming, and thank you for speaking into my work as well, because really it was nice to see how you looked into our children who are very vulnerable, and you were very thoughtful to bring this whole, piece of work together for us, so that we pay attention without confusion. Does that make sense?
Mhm, mhm,
And
exactly.
so much information then, and you go away thinking, oh my God, where do I start? Nata is saying this, Howa is saying that. But you blended it in beautifully. And for those that haven't followed us, please follow, like, subscribe, and comment, and hit the notification button.
Thank you so much for having me. It was really lovely. If I can help even one mum or one dad just feel a bit more comfortable with just their brushing technique and helping their child through their oral hygiene regime, it makes a huge difference. It will change their entire life. It seems like such a minute thing, but just brushing and reducing sugar changes their entire life. So I hope that it will make that difference. So yeah, thank you for having me. And yeah, I'll gladly be back. I love to talk about this.
Cheers, you're gonna cheers. All right, beautiful souls, we're gonna say goodbye from here. And I love you guys. Just keep doing the work that you're doing. We'll see you in the next podcast. But from my heart, cheers. Bye bye for now.
Bye.